The single dumbest idea in the world as it relates to the caring of seniors comes from Gavin Newsom. The I'm going to try to stay out of politics here, folks, but I can't. It's just the single dumbest idea ever. And let me just read you some stuff. About 1/3 of Americans will reach age 65 will need nursing home care in their lifetime. 1/3 of all people reaching the age of 65 will need nursing homes in their lifetime. That's a statistic. Here's another one. That's from what is that from? Stat, a medical newsletter. This is from another one called Skilled Nursing News. By 2030, approximately 20% of the U.S. population will be 65 or older, which means they're going to need more and more and more care. Where are we going to find nurses? Megan English, chief people officer at Marquise Companies, said during a read. We're already looking for them and we can't find them. And then there's no funding element. We can't get nursing. There aren't enough registered nurses sitting around waiting for jobs. So what does Governor Newsom do? Knowing all this, we have a crisis in California. I can't find people who need nursing homes beds in nursing homes or hospitals or any place else. And you want to know the reason why? Is because Governor Gavin Newsom, the boy wonder who knows nothing about anything except maybe how to keep his winery open during COVID. Newsom wants to take 6.7 billion. Now remember, he expanded Medi-Cal in California to anybody, documented, undocumented, legal, illegal. It doesn't matter. You can get Medi-Cal in California. Everybody told him, I said it on this program, that it was a mistake. But he doesn't listen because he wants to be whatever he wants to be. Newsom wants to take 6.7 billion that had been earmarked for increased Medi-Cal payments to healthcare providers and instead help it to plug the state deficit, because we have a $30 billion state deficit. Why? Because he's an idiot. You promise everything to everybody, and then when you find out you can't pay it, where do you take it from? You take it from the healthcare for old people. Groups representing doctors, hospitals, and patients warned the cut could weaken an already overburdened healthcare system that serves 1/3 of the state populations. 1 out of every 3 people in California is on Medi-Cal. 40 million people. 15 million of them are on, 12 million of them are on Medi-Cal. But here's a good idea. Let's cut that because we have a budget deficit because we promised this to everybody. I can read on and on and on and on. Here's one from Cal Matters. You should all read Cal Matters if you really want to know what's going on. The single largest cut in Gavin Newsom's new budget hits healthcare providers. Newsom wants to take $6.7 billion out of healthcare and give it to the budget deficit. And on and on and on. I can't tell you what a stupid idea this is and how much it impacts seniors and the people who love seniors and their families. You should be aghast. You should be following this. Why am I having to tell you this on a YouTube channel or on my Facebook Live or whatever? Aging population drives demand for long-term current care service against staffing shortages and low pay. 20% of the population will be 65 by 2030. 20%. We'll have more people over 65 than under 18 for the first time in history. And the governor wants to cut funding that he promised to healthcare and to Medi-Cal so that he can pay down the idiot deficit, I guess, to pay for the bullet train. Oh, we don't have how much have we spent on the bullet train, folks? How many of you have ridden the bullet train? That was another one of his promises that he can't keep. This is not a political thing. I am just so angry about this because at the end of the day, I deal every day with people who are denied access to hospitals, denied access to nursing homes, denied access to all of that because of reimbursement rates, which are being cut by the governor in order to increase his budget. And are you not paying enough taxes? I know who's not paying enough taxes, but that's a story for another day, and I really don't want to go there. But I care about my people. I care about people who are seniors and their families who don't have access to hospitals and don't have you're kicked out of a hospital in 2 days, and then you find you're going to pay $1,000 a day for rehab because you were under admission. You weren't under admission, you were under observation. And that, again, I don't have time to go into this. But we have the single worst governor in the history of California, in my opinion, when it comes to the issues of aging. He just doesn't care about you, seniors. The system doesn't care about you. As anybody who knows, I have to fight for clients every single stupid day to get them from the hospital to a nursing home. Families have had to, I had a family recently that mom was moved to to a nursing home, and they refused to admit her and kept her for a half an hour in the ambulance that brought her with the air conditioning on. I'm not making that story up. That's all a result of Gavin Newsom. So believe what you want to believe, but check it out and read it and find out that $6.7 billion has been cut by the governor from healthcare for seniors and redirected to pay down the deficit so he can give more money to more whatever it is, maybe to keep his winery open. I'm Bob Scrivano. Everything I talk about here on Navigating Frailty is my opinion only, is my opinion only, based on my 35 years of experience doing long-term care and Medi-Cal, based on my experience of caring about this stuff. You should care about it too, and you should be outraged. The legislature's not outraged. They're just as guilty as he is. And who controls the state legislature? Seniors don't matter. They don't matter to this administration or to this assembly. They don't matter to anyone. There's no one carrying the torch anywhere in politics, including the President of the United States. Oh, I'm worn out now. Make sure you follow me on Facebook. Make sure you go to my website, assetsandaging.com. Make sure you take advantage of my workshops and my free appointments. Make sure you're informed and your family is planned for the issues of aging. I hope you have a great day. Be safe, be warm, be silent. Don't be silent, but be kind to each other. Look forward to seeing you here or on my Facebook page or one of my upcoming webinars or workshops. You can check it all out at assetsandaging.com. Have a great day. Bye-bye.